Dr. V, I maintain excellent oral hygiene, brushing, flossing, eating healthy, and getting regular checkups. Yet I still get new cavities each visit. Could I just have bad teeth syndrome?
Well, definitely possible that you can have what we call it as a bad teeth syndrome. We always have ways to look for excuses, I should say, right? I know you can have genetics, you can have some saliva issues, and maybe have some hidden sugars or any type of acidic foods that you may be high on, and maybe you have a little bit of pH, meaning like acidic versus alkaline imbalance in your mouth, and you may have like a micro the bacteria in your mouth or the oral microflora in your mouth could be different. These are like possible causes, right? And but having said that, the bad teeth syndrome could be real, and although it is kind of like kind of a loose term people use, and people who are really looking for excuses can do that, and that's what they say. However, having said that, so how can we overcome that? Let's talk about not the problem, the solution, right? So it's kind of like if you have diabetes or heart problem that runs in your family, are you at a higher risk for getting those heart problems and diabetes? Of course. However, if you lead a healthy lifestyle, meaning like you eat right, you exercise right, and you go to the doctor right, and if you do all of those things, you can overcome that. So although the bad teeth syndrome could be real, you can contract from your mom or dad or your family members, but you can overcome that by, for example, using fluoride mouthwashes, using some sugar-free chewing gums, and going to the dentist on a regular basis, being extra diligent about doing some saliva testing, some bacterial testing, and getting your oral hygiene care like every 3 to 6 months, and getting sealants and fillings and gum disease treatment if you happen to be in the Dallas-Fort Worth area at ToothHQ. So
Come see us.
right, correct.
That's right.